Hi, today I'm going to talk about hydrocortisone plus fludrocortisone in adults with septic shock. First, we have to define what is septic shock. Septic shock is a serious medical condition that occurs when sepsis, which is organ injury or damage, is response to infection, leads to dangerously low pressure and abnormalities in cellular metabolism.
Septic shock is a generally life-threatening disease of an infection. Septic shock causes when chemicals released into the bloodstream to fight the infection start inflammatory reactions throughout the human body. This inflammation may cause a cascade of changes that may injure multiple organ structures, causing them to fail. Anybody can increase septic shock, but it is the majority common and most risky in those with weakened immune systems or older adults. Early treatment of septic shock, typically with huge amounts of intravenous fluids and antibiotics, progress chances for survival.
Then we have to know the causes of septic shock. The septic shock could be caused by a lot of microorganisms, including bacteria, viruses, parasites, and fungus.
Septic shock causes the majority often in the very young and the very old. It can also happen in people with weakened immune structures. Any kind of bacteria may cause septic shock. Fungi and viruses can also worsen the condition.
Toxins released by the bacteria or fungi can result in tissue injury. This can lead to poor organ function and low blood pressure. Many examiners think that blood clots in small arteries source the poor organ function and lack of blood flow. While any kind of infection, viral, bacterial, or fungal may lead to septic shock, the majority possible varieties include kidney infection, bloodstream infection, pneumonia, abdominal infection.
So, how do we treat the septic shock with corticosteroids? And how does the corticosteroids work? They are drugs that are synthetic produce hormones that can simulate cortisol, because if similar, they block white blood cells from attacking the tissue and decrease the inflammatory causing substances these immune cells produce.
Corticosteroids are drugs that can be inhaled, given orally, topically, or by intravenous or intramuscular injection. They are synthetically produced hormones that are very similar to cortisol. They block white blood cells from attacking the tissue and decrease the inflammatory causing substances these immune cells produce. Corticosteroids are frequently used for treatment of inflammatory and autoimmune disorders, such as rheumatoid arthritis, systemic lupus erythematosus, and certain respiratory disorders.
What are the advantages and applications of the hydrocortisone and fludrocortisone? They are used in the treatment of cerebral salt wasting syndrome, replacing the missing hormone aldosterone in various forms of adrenal insufficiency, such as Addison's disease or congenital adrenal hyperplasia. Also in orthostatic intolerance and postural orthostatic tachycardia syndrome, adrenocortical insufficiency, adrenogenital syndrome, high blood calcium, thyroiditis, rheumatoid arthritis, dermatitis, asthma, and also used in diagnosis of Conn's syndrome. What are the disadvantages? It could make mood changes, increased risk of infection and swelling, osteoporosis, upset stomach, physical weakness, easy bruising and yeast infections, immune suppression, Also, they can make sodium and water retention, hypertension, hypokalemia, insomnia, weight gain, depression, glaucoma, and increase the intracranial pressure.
There are short-term and long-term effects that you need to be conscious of. Be careful with elevation of blood sugar in our patients, especially with diabetes, as well as azotemia. There's a leukocytosis frequently associated with steroid use, as well as a left shiftedness with demargination of polymorphic nuclear cells. There can be a redistribution of fat, and certainly long-term use can cause a buffalo hump on the back of the neck. Fluid retention is frequent with hypernatremia as well as hypokalemia, as steroids increase the effect of the aldosterone pump. Topical application of the skin can cause skin thinning. Systemic administration can cause striae on the abdominal wall, so watch for that. Carpal tunnel syndrome is also a problem, as well as cataract involvement. Steroid myopathy affecting the legs is a key issue. I have a patient with Wegener's disease right now that's developed some steroid myopathy of her thigh muscles. Watch the bones, checking for osteoporosis, which is very common in patients with long-term steroid therapy. And also CNS problems can be an issue with short or long-term therapy, including insomnia, moodiness, and goofiness. So these are just some of the
statistics. 25% of the population in Ecuador have septic shock, are treated with fludrocortisone and hydrocortisone. Just the persons that have septic shock and adrenal insufficiency are threatened with those drugs. In conclusion, we have that hydrocortisone and fludrocortisone can help a person with septic shock, but it can't prevent it.
Does hydrocortisone given in the IV form help prevent progression to septic shock? Well, the current guidelines are if that a patient is in septic shock and using vasopressors, hydrocortisone given in the IV form is beneficial to patients. So, to answer the questions, can hydrocortisone prevent the progression to septic shock? A randomized, double-blind control study was done in Germany with almost 400 patients, given hydrocortisone IV for 5 days and a tapering dose over the next 11 days. This was called the HIGH-PRESS study, high for hydrocortisone prevention, PRE, of septic shock. And the bottom line, the answer is it did not show any benefit. It did not show any difference in the prevention to the development of septic